Welcome, everyone, to this episode of your Freedom Hub's Free Market Cash Patient. I'm your host, Jeff Cantor, along with Charles Froman. We're sponsored by the Marketplace for Health, Wealth, and Freedom, and we're absolutely the disruptors intersection. We are recording all these for posterity, and we also have another program which we're also recording on. But before we talk about anything else, let's point out the fact that we've got a big problem here. And we like to harp on it, but it is becoming much more obvious all the time. And then, of course, all the mixed information that you're constantly getting. So how can you decipher through any of that? So it really comes down to you to figure that out. Here's the other little show I was mentioning we run. These are the channels that come take a look. It's all about more freedom issues in a more generic area. And then again, these are the links to the site. Let's take a look for a quick gander. When you get over there, there's a lot to take a peek at. And in the drop down, you'll see this is where the webinars are archived. But one of the most important parts is this continuing the conversation tab. So when you click on that, it actually takes you over here where all the past guests are archived in that you can connect with them, get to their blogs, help donate, write letters, do whatever is related to these individuals. So this will be a really important resource for you to be aware of. In addition, when you hover over here, we've got the people that are fighting for our freedom. I'm sorry, under this tab over here, this is a critical one too. These are some of the key action items that are happening, as well as organizations that are fighting for our freedom in a variety of areas. So you definitely want to be aware of all of them as well. So now when we come back to the site, we're on home and we click on webinars, that's the main area where we are today. Excuse me, there's a little information about the site itself of what we're doing here. Here's a breakout on the people that are speaking. Here we are at the 1 for 7 today. A little further down, who's coming up, so you can plan your calendar. And then very importantly, here are the various links where the sites will be, the video will be archived starting over the weekend. Here's an example. This is the Brighteon page. So here you can see some of the stuff that's happened in the past. And then on that note, we're going to go into what we are discussing today. So I'm going to have Charles jump into gear here and introduce our guest.
Gladly, Jeff, and welcome, Dr. Prasad. This is a big topic for disruptors and innovators in the health space. So many have tried to figure how to reimburse on quality, not just on service. Others, patients especially, always wonder, if I need surgery, how do I know which surgeon is the right one? And others will ask, is the surgery even necessary? Surgeons have complications, others have good outcomes. And then there's that third question on out-of-pocket costs. There are huge deductibles in most insurance plans. And the better benefit brokers are cutting those costs. And we want to do that in a way that really helps the patient. So Dr. Prasad is a surgeon himself, ENT and a neurosurgeon around the skull. He can talk about that. It's really interesting how he tries to help the tumors that grow from or towards the ear and towards the brain. It sounds like a risky area to do surgery, but we need the best when we need that kind of help. So SurgiQuality is his venture, and SurgiConnect, and it's all about a system to help payors, the employers, and elsewhere get the right surgery if needed. And that's, we've had other presenters on these various topics. We've had, Dr. Brad Willems with ADX therapy. Dr. Arshad has his cash appointments app trying to find quality and good pricing. Dennis Patterson is rating the right hospitals to go to based on their surgeons. There's a lot of innovators out there, and it's a race to see who's got the real best one, because no one really is sure if we've got it. And some folks think Dr. Prasad's venture is the state of the art. So I'm excited, Jeff, to hear where we're at.
Me too. So let's get things going here. So Sanjay, I'm going to stop sharing and give you control of the screen.
Yeah, it sounds great. No, Charles, Jeff, thank you so much for inviting me. I certainly appreciate your time and making this possible. Okay. Yeah, I've been a practicing surgeon for that's correct, almost 30 years, and I've been part of the problem. I've been part of the problem because what I've seen, I haven't acted on, and I'm guilty. And in 2014, I just got fed up, and I got tired of patients getting surgery that they don't need. I got tired of patients getting connected to surgeons that really have no business doing the procedure. And I got tired of patients even having complications from unnecessary surgery. And I just got fed up. I mean, my own friend had a hip replacement. He had the wrong size hip put in. He ended up having revision surgery, another revision surgery, got an infection. It was horrible. Had a Hoffman device. It was on intravenous antibiotics, almost lost his leg. And this whole system has to change. And I respect what you all have built in terms of cash payment systems. But, as you know, right, quality reigns supreme. And our mission, and I didn't do this on my own. I came together with a bunch of surgeons who were really fed up with the system. And we created a system where there's some accountability for the first time in healthcare. And we're all about quality and outcomes, past outcomes. Our mantra is know before you go. And what we've done is created a system where patients can enter into our platform. They can be met with a concierge. Their records are essentially uploaded to the cloud. They're being sent to multiple surgeons for pricing and quality. I'm going to show you pieces of this platform, and I'm going to show you some cases and how we're diving so deeply into quality, and it is absolutely essential. And the bottom line is the patients have the choice of where they want to go based on price, of course, but also now they can quality score and see surgeons for what they are. Get to the next slide. The problem we know is the referral process. Patients are being referred from primary care docs to surgeons without any concern for cost, any concern for quality. Patients are getting unnecessary surgery. Patients are getting complications from unnecessary surgery, and patients are just not connected to the right surgeon. And this is the problem that we see. This is the problem we're trying to fix. Our solution, the SurgiQuality solution, works very well with DPC. There's no question. But essentially, a patient is told they need surgery. Our platform is part of their summary plan description. Patients are mandated to go through the platform, but ultimately they decide who they want to go to. A concierge reaches them, uploads their medical records and their imaging to the cloud, all in a private and secure manner. And this is sent to the cloud and then distributed along a very complicated SaaS platform that works with private practice and employed surgeons. It works with anesthesia. It works with pathology. It works with surgery centers. It works with the hospitals. The whole platform has been built out. Surgeons are pre-qualified before they can enter the network. They must be board certified. We do check out their CAQH for malpractice history. Before we do that, we don't make them active. So essentially, we're taking cases, surgical cases, and sending them to surgeons in the region where the patient desires to have the service. The surgeons are reporting back how many cases they've done the previous year, what's their success rate, what's their complication rate, and I'm going to dive deeply into that because that's our core mission. And of course, a bundled price, all-inclusive pricing along with their facilities and the post-op care and the anesthesia, the implants, etc. So where are these providers? Well, through collaborations with national surgery organization, national surgeon organizations and surgery center organizations. We have 30,000 surgeons. We have 50 state coverage, 300 surgery centers and hospitals. And what the patient sees, and they can see this in multiple different ways, but this is how they see it on their app. They see the various doctors, the surgeons that have opined on their case, reviewed their case. We give them an option with pricing competition. So patients who've been referred to surgeons that where they have a $5,000 deductible through price competition, we find them lower cost options and zero out their deductible whenever possible. But our mission really as surgeons is really this, and this is a quality scoring card for surgeons in terms of number of cases performed, success rates, complication rates, and I'm going to dive very deeply into this in just a minute. This is an example of a patient. This was a business owner in Wyoming who developed a seizure, ended up in the emergency room, had an MRI scan, and they saw this white lesion in his brain. He was already being referred. They'd tried antiviral treatment, it didn't quite work. They thought it was a tumor. He was being referred to an academic center for complicated surgery, to have a biopsy and excision of this, and with possible complications, et cetera. We caught this case in the middle of a holiday weekend, and we sent this out, and within 24 hours, we had multiple surgeons report back, and this is the surgeon that wanted to operate on the patient, but we had multiple surgeons report back that this is not a tumor, this is a virus, and that you should repeat the MRI. And sure enough, we did repeat the MRI and the lesion did disappear. So it was in fact a viral infection. And here the patient would have had complicated craniotomy surgery and would have had potential for complications. I mean, think about the costs involved with this. What a great save this was, right? And something as simple as even colonoscopy. You're told, you go from your primary care doctor, you go to your gastroenterologist, you get scheduled for a colonoscopy, you just go have it done today. And you have no idea about the quality scoring of that surgeon. That is the number of cases like that he or she's done in the previous year. What is their adenoma detection rate? This is so critical because an adenoma is a tumor. And so how often do they detect tumors when they do colonoscopy? Well, according to the American College of Gastroenterology, if your adenoma detection rate is less than 20%, you're not being careful enough in looking for tumors. So your adenoma detection rate has to be above 20% to be considered a high quality surgeon. And so this gives us, right, this gives patients an opportunity to look at different surgeons, look at their number of cases performed, ADR, how many times they've perforated the colon, how many patients have actually died because they perforated the colon, the patient developed a massive infection in the abdomen, eventually succumbed. So this is so critical to have, right? And there are going to be surgeons that won't report their data, right? They won't report, but we'll put that out there and the patient will wonder why. This is gallbladder surgery. It's done through laparoscopes these days, right? And so you have a tummy ache, you have an elevated bilirubin and upper quadrant pain in your abdomen. You're told you have gallstones on an ultrasound. You get referred to surgeon A. He says you got to have your gallbladder removed. And other surgeons in our platform do agree. But the surgeon you've seen won't report his data. He won't report the bile duct injury rate, conversion rate. And a conversion rate is nothing more than the surgeon got into so much bleeding that they basically had to open the abdomen to get the gallbladder out and get control of the bleeding, and how many patients had died. So what we're doing is we're giving patients quality scoring amongst surgeons. This makes sense. And you may wonder, well, Surgeon C, he gets a lot of cases, right? But he has a lot of injuries. And how could that be? Well, this is the profile of a surgeon in a center for excellence who sits in an academic hospital, gets lots of cases, but didn't really train with laparoscopic surgery, right? So he's used to opening the abdomen and removing the gallbladder, but not really adept with laparoscopes. So he gets a high degree of bile duct injuries. And nothing is done really until there's an operative death. Jeff and I talked about that. So the system doesn't police itself. So we need more help. Patients need more help. For patients who need a cornea transplant, where the cornea is basically replaced by a donor cornea, we're looking at metrics that matter to them. We're looking at vision rate, 20 to 40 vision rate at 90 days, and we're looking at graft failure rate. So we're looking at quality scoring that really makes a lot of sense for the patient. You get numbness in your arms, you're told you have a disc problem in your neck, you go see a surgeon and they want to do a discectomy with fusion. We are looking at quality measures that make sense for the patient. We're looking at how many times a surgeon had a laryngeal nerve injury, a carotid or vertebral artery injury, and got into so much bleeding, hurt the esophagus and needed high-risk esophageal surgery, and how many times they had spinal fluid leakage. So we're looking at quality scoring so that patients can pick and choose who they want to go to based on quality measures that matter to them. And our concierge explains all this to them. Total knee arthroplasty. We're looking at things that you probably don't even think about, but pulmonary embolism is something to be really concerned about, where you can get air that enters into the venous system in your legs, ends up in your lungs, and causes a lot of trouble. You can even get a heart attack, infection we all know about, but now we've got metrics against surgeons. Now patients can pick their surgeon accordingly, right? So we can use quality measures to steer patients toward lower cost options. And this is something that is only possible in our system, right? So here's a patient who developed a colon tumor, had seen a colorectal surgeon, and was all set to have colectomy surgery. That is, remove a part of the colon and put it back together. High risk, inpatient surgery, long recovery, high complication rate, not to mention high costs. But there are gastroenterologists. Now, we send this case to surgeons based on their area of interest. So they both indicate that they have an area of interest in colon tumors. So we send it to an interventional gastroenterologist who can remove this through an endoscopic technique, through a colonoscope, remove the tumor, and get you back to work within a few days. The cost is 1/10 of what it could be. And the same thing happens with complex brain tumors. We can send it to a radiation therapist, we can send it to a neurologist like me, or you can send it to a neurosurgeon. They have their different approaches in how they treat, and the cost difference is so incredibly great. Know before you go. It makes all the sense in the world. I'm going to pause here and take some questions from here.
Okay, very good. Well, that was fantastic. Let's see what we've got in store for us here. Everybody, if you'll raise your hand would be fantastic, and I'll call on you accordingly. And I see Charles is going to kick us off.
For sure, Jeff. And Dr. Prasad, that was really helpful, itemizing the specific risks, the complications that can stem from these important surgeries, and those visuals are striking. The slides are clear. I would like to maybe call on some of the doctors who are joined with us, like Dr. Wallen, a urologist who's very gung-ho on the independent price revolution, or Dr. Testa, who might be presenting with us pretty soon. what they think about this rating system. But I know there's other entrepreneurs out there trying this, but it seems like, Dr. Prasad, this is still an unmet need, wouldn't you say?
Oh, no question. No question. Yeah, I'm happy to take your questions. Yeah, go ahead.
Well, first off, I see Paul's got his hand up, so let's let him jump in here real quick.
Yeah, great presentation. Just want to say, it's great to see value-based medicine this way. So much of the time we see the opposite, with the profit-driven model instead of value-based model. So kudos for that. My question would be, what do you think the challenges or what have you seen the challenges are in terms of the status quo? Are they pushing back, as far as the profit-driven, versus value-driven model? Is that a challenge at all?
Are you talking about the provider end, or are you talking about the benefits end, or the patient end? Which?
Well, really any of it, but primarily I'm talking about when I'm saying value-based, it's outcome-based, right? So you're looking at the outcomes, the surgical outcomes, and in that way it's value-based. So that would be primarily the question. Most medicine nowadays, the status quo is, it's profit-driven essentially. I mean, you were mentioning all the surgeries, and people don't need surgery necessarily, or they're not qualified, etc. So I love what you're doing. I'm just wondering, is the status quo pushing back on you somehow?
Well, the status quo is always pushing back, right? There's stakeholders that don't want to see this come to light, and yeah, I mean, there's going to be, there's going to be early adopters, no question, right? They're going to be surgeons who are younger, technology adept, and who are willing to put their quality outcomes, their outcomes out there, and they're going to have to do that, right? Eventually. Because the patients need to demand this, right? They need to demand this. And those days are gone when they get referred to a surgeon and they have no idea of their outcomes. So it just doesn't make any sense to me.
Yeah, no, I agree.
Sam, I see your hand up.
Yes. Hi, Dr. Prasad. I love what you're doing. Multi-part question. Can you talk a little bit about the business side of your company? How do patients find you? And what type of providers do you have? Are these certain types of hospitals and certain types of doctors, or it's all over the across all categories? A little bit more detail about who these providers are, and also what's your business relationship with them?
So we have a collaboration with surgery center management companies, and also surgeon groups and networks. And so we have 30,000 surgeons in 50 states on the platform. So we have surgery centers and hospitals as well. Look, they're going to be, even within our network, there are going to be some surgeons who are going to be reluctant to share their outcomes data. And this platform is not for everybody. It's not for every surgeon. This is only for high quality surgeons who are willing to put their outcomes data out there, and get together with their surgery center and hospital and put in a bundled price. Does it make sense?
Absolutely. And what's your arrangement with them as a business?
Yeah, we don't charge them. We don't charge the surgeons or the surgery centers or the hospitals to be on the platform. We don't. Their incentive is really, hey, get on the platform. You could potentially have access to patients you don't have access to today.
Yeah. And do you charge the patients some kind of fee for the concierge service, et cetera, or other?
Yeah, it can vary. It can vary. It varies on the plan. So some plans we do charge, and some we don't. It just depends. It depends on their self-insured plan.
I see. And how do patients find you? Is it through the employer? For example, I hadn't heard about your company until today. So I'm just curious to know how do people engage with you, and how do you reach out, or how do you enroll people in your program?
It's a B2B play. We are business to business, so we're with self-insured employers, so, and some cost sharing plans as well. So you have to reach us through the employer to get this kind of service. We haven't gone B2C. We certainly could, but it just seems to be much more complicated right now, right this second.
Got it. And how do your costs compare? This is my last question, I promise. How do your costs compare to the, say, median costs or average cost of procedures? Is it higher, lower? Can't tell. Is there a cost
The
implication
cost of the procedure?
to the higher quality? Yeah.
It varies. It depends on the geography, but by and large, it's very, very competitive. This is a platform that's for bundled, payments and bundled services. We're looking very, very highly at very competitive pricing, but the quality's got to be there. If the quality's not there, this platform is not for you. If you have high pricing and you have high quality, it doesn't work, right? It doesn't work. You really need moderate pricing, reasonable pricing with high quality, and that's what's going to work.
Got it. Thank you.
Very good. Dr. Testa?
Hi, Dr. Prasad. I love what you're doing. I think it's great to get quality information in front of people. I'm dealing with a medical issue myself, and it's, if I wasn't in healthcare, I'd have no idea what to look for, what to ask for. It's scary. So thanks for putting this in front of people. Question. I've been in an integrative care practice for, I'm a chiropractor, so working with primary care, physiatry, anesthesia, pain, and, we all get a little help each other in this process, but we all knew some people were not good surgical candidates. And so I'm just curious, what do you do or how do you deal with people who, like, the consensus come back, not a surgical candidate? Is there some next step that your concierge help them find something to replace what they were looking for with surgery? On my day in my business today, I'm on a stem cell network that deals with orthopedics using blood platelets and bone marrow concentrate. Yeah. And sometimes we work with other surgical centers of excellence who go, okay, it's not a surgical candidate, try this. And they might not be a candidate for ours as well, but I'm just curious, what do you do when they're not surgical candidates?
Right. So remember, we're getting multiple opinions, right, from surgeons, but surgeons, first off, are validating necessity of surgery. And if they think surgery is not indicated, they also indicate the type of treatment they would recommend. So that's the information we get back to the patients. And there's no reason why chiropractic, physical therapy can't be advocated for. There's no question.
Yeah. Okay, good. That's great. Because, sometimes people are left with, now what do I do? They were hoping this was going to fix
we follow the patient all the way from the time that they're told they need surgery until they're back to work. So we would send them to a physical therapist or a chiropractor, or, at least give the patient the option, right, from having surgery, right?
Right. Yeah, that's great. Everyone we can keep away from an unnecessary surgery is a great thing. So thanks for what you're doing. Wish you all the best.
Thank you so much.
Excellent. Christina, I see your hand is up.
Yes, can you hear me?
Yes.
Hi, nice to meet you. Great presentation. I've been working in medical tourism for a long time, so international healthcare, and what you're doing, I think, is awesome. That's kind of part of the project, is getting this quality thing, and the way you've broken down some of those metrics. You mentioned you're not B2C yet, but I think a lot of what you'll be handling is getting the patient to understand that those are the metrics they need to be concerned about. And you gave some of, absolutely. So that's great to have concierge. That's what I do as well. I'm wondering about the reported data. My organization, I very much am interested in getting quality outcomes and things, and being able to report those and assess those. So I like that you've got the medical part of it. I'm kind of more on the patient experience side, but I'm wondering, my problem I feel in healthcare is when doctors and hospitals self-report. You can't always trust that. And so I'm just wondering if they are, are you getting them to self-report? Is there any kind of accountability or oversight on that? How are you policing that, or you know what I mean?
No, we're not leasing it.
No, policing it,
the reporting is absolutely critical, right?
Yes, absolutely.
So it's absolutely critical. And I'm so glad you mentioned it, because you hit the nail right on the head. you can report whatever you want, but
Exactly.
we'd have to corroborate it, right?
Exactly.
So if you've done 100 gallbladder surgeries last year,
Mm-hmm.
They would have to provide in their EMR that CPT code was used 100 times. So, we would query their EMR, get their CPT numbers, and then we'd look for complications, as we mentioned, through ICD diagnosis. So this is possible. This corroboration is possible. And nobody's really diving into quality, into procedure-specific, surgeon-specific quality, like we are.
Mm-hmm.
And there's an absolute need, right? Absolute need.
Oh, absolutely. I cannot agree more.
Yeah.
That I'm on the patient side. In fact, I've called myself a medical concierge for about 20 years. So I really like that, that side of it. And this has been a big thing. And the other thing that I feel is it's great to have the clinical measures as you're doing. I think that's awesome. And I'd really like to see about incorporating that. But the other side of it too is, the rating systems that we do have for, a patient to choose a doctor or surgeon, whatever, it's Yelp and Google things. And I maintain the fact that patients do not know how to rate doctors. They rate them on how nice they are to them. They have no idea kind of what goes on behind the scenes. And even sometimes whether or not a complication is actually a doctor's fault, they're able to kind of think that. So I really like a lot what you're doing. And,
well, I don't want to plug it too much, but I just wrote a book. It's coming out in the next couple of weeks on pragmatic solution for the price patients pay.
Mm-hmm.
And it's all about educating patients about these quality measures and how important it is. They really need to, we need a grassroots revolution.
We do. Oh my gosh.
Because people need to start to understand that, surgery is being advocated a bit too much, and we need to be able to go to surgeons that have the best outcomes, when we're having surgeries, no question.
Yes, I cannot agree more. You just resonate so much. I will give the floor to somebody else, but I will definitely like to connect with you after the.
Oh, please
afterwards.
do. Please do.
Wonderful.
Fantastic.
Yeah, we'd be delighted.
Well, and that's good. And that's the purpose of our event here, is we're always trying to connect everybody so we can start getting some synergies going. So this is nice to see sausage get made.
Thanks, Jeff and Charlie.
Oh, no question. Thank you for being here to make it happen. Charles, I see you got your hand up.
Sure. And Dr. Prasad, if you have more to present, by all means, continue. Otherwise, we'll keep the questions coming, however you want to proceed here.
Oh, just keep the questions coming. I don't really have much more. I'd rather answer those questions that people have. So go right ahead.
Okay. First, I have a question, but tell us more about your book, because we love plugging books and ventures. After I ask you this question, tell us a bit about the rating systems that exist right now. Full disclosure, the Forbes feature sharing health savings account plan that we push and sell to make cash shopping patients has Blue Book to help patients find, cost-effective options out there. I mentioned some others in my intro. I don't know if they're competitors of yours or if they're not. Jeff and I have been to AAPS meetings where some of these rating ventures have presented, some using nurses to find the best surgeons, some using film of surgeons to have peer review. Would you mind telling us about some of your competitors or some of the state-of-the-art search engines out there right now and why they are insufficient and where you've learned from their mistakes to get to the next level?
Yeah, I mean,
if that makes sense.
This whole endeavor with quality measures that are procedure specific is really in its infancy, Charles. Great question, by the way. It's really in its infancy. Right now, we're looking at volume, and we're looking at success measures and complication measures. We can envision a time when we're actually looking at laparoscopic video of surgeries being done by surgeons and rating them. So I think that's coming. It's coming whether you like it or not. And it's going to get even more refined, right? So in this information age, anything's possible. You can have infinite data points. And so, for each procedure, every common procedure in every specialty, The quality measures are always going to change, right? And it's all a good thing, definitely. What are the competitors doing, Charles? I think most are using Medicare data, which is great, but it's a great start, for example. And but it's not procedure specific. It may be surgeon specific, but it's not really diving into quality measures for each procedure. You can't look at Medicare data and find bile duct injury rate for cholecystectomy or gallbladder surgery. It's just not there. And you need to know, before you undergo surgery. It just makes sense.
Well, quick follow-up, Jeff. Well, I'm sold, and I'm sure most folks you speak to are sold. And in the big group market, Dr. Testa, who asked a question earlier, he's sort of in this innovative benefits world, the Rosetta brokers. They're the ones kicking out the bucas and with self-funding and direct contracting, bringing in innovative ventures like you to help the filter process. How are they responding to you? You must be getting some traction with some of the better benefit advisors, correct?
Yeah, we are. Surprisingly, we've gotten quite a bit of traction from Fortune 100 companies. It's hard to believe because remember, their employees are told they need surgery and they go see a surgeon, right? They're told they need surgery, and then they have a provider book. And they have no other way to find the best surgeon within their network. So even the big companies are looking for this kind of service where, within their network, they want to find the most qualified surgeon. So there's a thirst for that. There's definitely a need, no question.
Is it just your Fortune 100 top companies? That's great.
No.
Great to hear. Great for you.
No, we've certainly gained a lot of interest from some very large concierge services for the Fortune 100 companies. Look, we talked to Health Rosetta. We're very interested in talking to Hint Health because I think this would fit so well with DPC. Anyone who's using DPC really should be using our service as well, because now you've got the primary care physician, who's armed with this quality data on surgeons and can appropriately refer, avoid unnecessary surgery and get to the highest outcome surgeon. It just makes all the sense in the world.
Absolutely. Since you've got a good insight now with all of this hindsight, here's a little conundrum that always has thrown me through the years. Every year that U.S. News has its annual issue about the best doctors. What in the world are they using to come up with that list?
Well, that's part of my book. I don't want to preempt it too much, but look, you go drive down the highway, right? You see these billboards, right? Best hospitals, best doctors. You go to the airport, you're inundated with banners in every airport you go to. Maybe not during the pandemic, but before. You go to any sports arena, you're inundated with logos, best hospital, best doctors. All we're asking for is some accountability, right? And patients and Americans deserve that.
And that's the least that we deserve. So that's so good. And again, somebody's got to start setting that pace. So that's very good. All right, well, let's take some other questions here. And if you don't really necessarily have the ability to, here's a good one. I'm going to pick on somebody. Dr. Wallen, I was going to say, you're kind of a little bit into this mentality. What's kind of your take on this?
Thanks, Jeff. I guess, the reality is quality is certain. Obviously, I don't think, at least maybe this is naive, but I don't think most physicians get into the practice of medicine to harm patients, right? I guess, my question would be twofold. One, how can you be sure that the validated data that you're getting from self-reporting from surgeons? I know you kind of mentioned being able to go back through EMRs, but are you getting, actually like Hipaa clearance to be able to do that, to be able to get to the raw data and be sure that that's actually, an accurate marker?
Yeah, you don't really need you don't need to do that.
Sorry?
Let me just interrupt for a second. You don't really need to do that. All you need to do is run, if you have EMR, whatever EMR system you have, you run the gallbladder code, CPT code. and you look at that year, it's, you know, and you get the number. I mean, it's not, you're not violating HIPAA at all.
Right, but how does that equate to any potential complications?
So then you take that CPT and then you run ICD complications, ICD codes against that CPT database.
So right, that's only if they're self-reporting then those complications, right?
Yeah, but that's what you do. That you corroborate. That's how you corroborate it. Like they report a certain
Right,
percentage of
but
complications,
I mean,
and you check for those complications across those CPTs.
right, but so if they're not actually self-reporting the complications, then you wouldn't pick it up within the system.
You might very well, because you know you're running. Again,
Fair.
it's all electronic now, so it's actually makes a lot of sense. You run, you know, the gallbladder CPT code to find the denominator, and then you run the ICD code for bile leak, for example, and you find the numerator. So it's really quite simple. I mean, just you don't need HIPAA. You don't have to worry about HIPAA. This is, you know, we're not looking at patient data. We're looking at volume.
All right, fair. And I guess on the back end, the flip side of that, then, you know, how does this become protected from becoming a way that corporations, lawyers, what have you, start attacking physicians for potential malpractice then?
Well, you know, it's not a platform for everybody, right? So if you feel as a surgeon that you have a high degree of complications and you don't want to report, that's fine. This platform doesn't work for you. We understand. But you know, you know, for surgeons who have great success, very low complications, a reasonable pricing, this just makes all the sense in the world. And those are the surgeons we want to attract.
Just to say that's kind of the keys. You're attracting
So
the
what
person who's out there excited about their record as opposed to trying to just kind of avoid it.
Absolutely, yeah.
Fair. So I guess from that standpoint, though, then what value or credibility from a surgeon standpoint do you bring that I mean, basically, I mean, we all know direct to consumer marketing is, you know, the standard.
Yeah.
So why would someone like myself, you know, join this? If, I mean, what value is there for that?
Well, I don't know what your specialty is. What's your specialty?
Urology.
Urology. So, you know, if you had, well,
Urologic
like an
surgery.
orthopedist, I can talk about orthopedics a little bit, but if you had 10 hip replacements and 10 patients that are looking for a surgeon, it's a great place to get cases, right? So access to cases, and, you know, whenever possible, we try to pay you, you know, on that day or previously, if we can, before the date of service. So we simplify your claims processing. We give you access to new cases, you know, which is phenomenal, right? I mean, I'm a surgeon and I get paid sometimes 3 months later, 6 months later, sometimes a year later. And so we can simplify that, eliminate our AR, eliminate collections. It just makes all the sense in the world.
Very good. Okay, any other quick questions here? We're cutting down to the wire here, but that was very good.
Jeff Charlie here.
Please.
Dr. Prasad, without spoiling your book, which I gather you don't want to at this point, obviously it's going to include, you know, some filter for surgeries like you presented tonight. You kind of have this evinced that you had this grand vision for grassroots health reform, patient empowerment, fixing unneeded surgeries. Do you have some other bullet points to your grand view for a better health system? Don't want you to give away your book, but that's what we are about here every week, is some big ideas. Anything else that you think we should know about that would kind of complement your surgical quality finder?
No, I think you hit the nail on the head. And I you know, we are, we're all about quality. We're surgeon owned and surgeon run. We know quality like nobody's business. And, you know, there's just got to be more of it, right? And patients need to be better educated. There's no question, right? They don't understand what a bioleak is. They don't understand what a laryngeal nerve injury is and what it means to them long term. So that's what our concierge is all about, is educating consumers to make well-informed decisions. That's what it's all about.
Very nice. You know, what's interesting is an observation here of us having been doing this show for a while, is that all these really great little entrepreneurial innovations like what you're doing here, there's always doctors behind it. No companies or whatever, just a bunch of entrepreneurial doctors that figured it out. So I'm really glad you guys decided to step outside the surgical bay for a minute instead of just doodling on a notepad about this problem. That's quite good.
Great.
All right. Well, I'm going to tell you this. We're definitely down to the end here. So I want to thank you so much for spending some time with us today.
My pleasure. Thank you so much.